They might be your favorite go-to outfit, but what if those stylish, tight jeans you've been wearing are quietly harming your health? For millions, denim isn't just a fashion choice, it's a daily ritual. Yet behind the iconic blue fabric lies a serious health hazard that often goes unnoticed. If you've ever felt tingling legs or tightness after wearing jeans, what you're experiencing might be your body begging for better blood flow. Before we continue, we would love to know, where are you watching us from? And also don't forget to subscribe and like the video, for this means a lot to us. Fashion often promises confidence and compliments, but sometimes it delivers consequences instead. One staple that has remained in wardrobes for decades is denim jeans. From the rugged appeal of blue-collar workers to today's runway models, jeans have stood the test of time. But beneath their iconic appearance lies a growing concern, especially when it comes to how jeans impact healthy blood flow. Most people don't consider clothing as a factor in their cardiovascular health, but research and medical cases suggest otherwise. Jeans, particularly tight or skinny ones, can act like a soft tourniquet, compressing arteries, nerves, and muscles. Blood circulation depends on the free movement of vessels and tissues. When denim becomes restrictive, it interferes with this natural flow, especially in the lower limbs. Take the now well-known case Newsweek. A woman wore skinny jeans while helping a friend move house. As she squatted and moved repeatedly, she began to feel her feet go numb. Hours later, she was hospitalized with muscle swelling and nerve damage. Her jeans had to be cut off, and she required fluids and rest for days. Medical professionals confirmed that prolonged squatting in tight pants compromised blood flow and nerve function in her legs. When you wear jeans that are too tight around your waist, thighs, or calves, your veins and arteries face unnecessary pressure. This impairs circulation and leads to symptoms like tingling, numbness, swelling, or even pain. It's similar to the way compression socks work, but without the therapeutic intention or even pressure distribution. Another overlooked danger is how jeans can contribute to a condition called meralgia paresthetica. This occurs when a nerve in your outer thigh gets compressed, often due to tight clothing. Symptoms include burning pain, tingling, or numbness in the thigh area. Although not life-threatening, it can greatly affect comfort and mobility, especially for those already dealing with circulation issues or diabetes. From a health standpoint, fashion needs to accommodate function. And for seniors whose vascular health may already be compromised by age, wearing tight denim can be more than just uncomfortable, it can be hazardous. As we age, our bodies undergo numerous physiological changes. Blood vessels become less elastic, muscle mass decreases, and skin becomes thinner. These changes make circulation more fragile and more susceptible to external pressures, like those caused by restrictive clothing. That's why seniors must be especially cautious about their wardrobe choices, including jeans. Healthy blood flow is essential for nutrient delivery, joint function, immune response, and overall energy. When circulation is impaired, it can lead to fatigue, swelling in the legs, slower healing of wounds, and even a higher risk of blood clots. Seniors with existing medical conditions like varicose veins, deep vein thrombosis, DVT, diabetes, or peripheral artery disease are especially vulnerable. Jeans, particularly ones made from stiff, unyielding fabric or those designed with a skinny cut, pose a double threat. They restrict both movement and blood flow. A tight waistband can press into the abdomen, affecting digestion and causing acid reflux, while tight leg areas can limit venous return from the lower limbs. Prolonged sitting, whether during travel, television watching, or reading, while wearing such jeans amplifies these risks. Moreover, restricted blood flow in seniors is not just a discomfort issue, it can lead to serious health problems. Conditions like edema, swelling, neuropathy, nerve damage, and even pressure ulcers can be exacerbated by wearing clothing that does not allow the body to breathe and move naturally. Another concern is reduced temperature regulation. Seniors already struggle to maintain body temperature. Tight jeans, especially those without breathable fabric, can trap heat and moisture, leading to skin irritation or fungal infections in the groin and thigh areas. And let's not forget mobility. One of the key components to healthy aging is maintaining movement and exercise. Tight Tight jeans can restrict stride length, limit hip flexibility, and cause chafing, discouraging seniors from staying active. To support healthy aging, seniors should prioritize circulation-friendly clothing, soft fabrics, elastic waistbands, and cuts that allow for a full range of motion. There are now denim alternatives designed specifically for comfort and health. Look for options with spandex or elastane, marketed as stretch denim, which offer the look of jeans without the drawbacks. You don't have to give up style to protect your health. The key is making smarter, more informed fashion choices that prioritize comfort and circulation. So how can one strike that balance? First, know the signs your clothing might be affecting your health. If you often experience tingling or numbness in your legs, notice red marks on your skin from your jeans, or feel tightness that leaves you short of breath, after sitting down, your clothing could be compromising your circulation. Switching to stretch denim or relaxed fit jeans is one of the simplest ways to reduce these risks. These styles are designed to provide more room through the hips, thighs, and calves, and they usually include materials like spandex to add flexibility. If you're shopping for a senior loved one, avoid trends like skinny jeans or jeggings that lack proper support and room. Instead, choose pants with elastic waistbands to avoid abdominal pressure, soft, breathable materials to prevent overheating and irritation, straight or relaxed cuts to allow freedom of movement, flat seams and lightweight construction to reduce skin abrasion and discomfort. Beyond pants, it's worth evaluating the rest of the wardrobe. Clothing should be easy to put on, allow for good posture and movement, and avoid creating pressure on sensitive areas like the waist, knees, or ankles. Don't overlook footwear either. Just like tight can affect leg circulation, poor shoe choices like high heels or unsupportive flats can affect posture and pressure points, further impacting blood flow. Ultimately, fashion should empower us, not endanger us. For seniors especially, health-first clothing choices are about preserving mobility, reducing health risks, and enjoying comfort in everyday life. So the next time you consider buying or wearing that snug pair of jeans, ask yourself, does it fit not just your style, but also your health? Jeans have earned their place in fashion history, but like all trends, they deserve to be re-evaluated under the lens of wellness. Tight-fitting denim may offer a sleek silhouette, but it can sabotage blood flow, increase nerve compression, and invite long-term complications, especially for seniors. Aging is already a time when circulation and mobility are under threat. Clothing should support the body's changing needs, not challenge them. With modern alternatives in material and design, there's no need to sacrifice health for fashion. So let's make a simple shift. Choose denim that stretches with you, not against you, because good health never goes out of style.